How you doing? Thanks for those that have commented and reached out about the videos we've been sharing. It's nice to see that you're feeling less isolated in the situation that you're facing. We're just doing a quick share today about antipsychotic medication and how that's being overused in a lot of instances in a very scary way. It's not a medical, I've got to do a disclaimer apparently, that it's not medical advice and every patient is individual, which I would have thought was a given, but sometimes it's actually not. So it comes down to the individual patient's need, obviously. Also comes down to finances and impact of those kind of things. There was a Royal Commission in regards to chemical restraint and overuse of antipsychotic medication in particular, and the unnecessary prescription of this. It is very scary to see what happens to people when they're not given proper information about what options are available to them and what can be tried. CBD oil is legal. It can be prescribed by a physician, and there are things that need to be done with the facilities, which is reasonable. They need to be able to administer the medication. So it's got to be done by a proper treating physician. It's got to be done on a medication chart. There has to be a sign sheet, all the things that go with that, which is achievable if you can all work together. It's good for you to know that it is your choice as the family member, the enduring guardian, to have a look at what medication is available and what can support someone who doesn't actually necessarily need an antipsychotic. Some of those drugs are very, very harsh and they can be overused in a really bad way. And it's not all facilities, but there's certainly some that really do misuse their power in regard to that. So if you can have a bit of a look, we're going to upload our letter onto the YouTube, which is written by the Commission, that states about choice, residents' choice, families' choice, and what can be looked at in terms of a kinder way to support your loved one with different ways. The antipsychotics and any medication that's used around behaviour modification is classed as a chemical restraint, so they may well class the CBD oil as a chemical restraint as well, and they will class that as an S8, a Schedule 8 drug. The antipsychotics, they can get hold of those within 3 or 4 days. They don't necessarily do a proper assessment. You're not always included in that assessment, nor are you given the right information about why it's needed. It's really good to get an advocate involved to look at those things before you just sign away that they need that drug. Because the things that happen with some of those drugs are irreversible and can make a bad situation much worse. So please have a look at it and see what's available. The antipsychotics are an S4 medication, which is crazy to think a CBD oil is an S8 and one is an S4, and how quickly the pharmaceuticals can be obtained. An assessment can be done, an email can be sent, a prescription can be written, and they can have those medications in their hands with all of that done before you know it, within 3 to 4 days. When you're trying to get CBD oil used, which is a much gentler way to support someone's system, it's a much kinder way, if that's your choice, it can take you up to 6 weeks to get that involved in the person's care. And the obstruction that can come with that is horrendous. The muck around that can come with that is horrendous, because there's no kickback for the CBD oil. With the other medication, with the pharmaceuticals, there is a kickback. It's not a secret. It's been going on for a long time. So check out what your rights are, what your patient rights are, what the actual needs are, and whether or not that is suitable. And please stand your ground, get an advocate, do some research, and go in there well informed to have a proper conversation, to stand up for your people. The statistics are really scary about the overuse of these kind of drugs, what's happening time and time again, and families are just devastated at the results of what occurs for some of the elderly people who can't speak up. So we're going to load this up onto YouTube, and we'll put the links in there for the things for you to have a look at. And again, speak to your medical practitioners as well, and get your advocates involved and start standing up, and don't be afraid. These places are not allowed to threaten you. They will, and they do. And they're only doing it because that they don't know another way. They feel quite disempowered and feel like it's a reasonable way to treat other people who all you're doing is advocating for the wellness and some sort of quality and kindness of care. So again, it's not all facilities, but there are a significant amount who are really doing some damage to our people. So we'll load it up. We'll put the link up in the comments when it's done, and then you can jump on and you'll be able to download the letters and stuff from the link. And we've put a bit of info into the blurb. See you later.